Creating this documentary series wouldn't have been possible without the African Charities Dashboard. Thanks to this platform created by the Deep Knowledge Group, you can discover charities, non-profits, and impact startups that are actively creating impacts on the African continent. Try it out by visiting the website in the description below.
As you know, community pharmacies are like the first point of call. You can just walk 5 minutes, you always see a pharmacy around you.
The general Nigerian disposition to healthcare is you cannot be sick or you will not be sick.
So typically, a Nigerian would spend hours trying to get treatment for something as simple as malaria, considering transportation, waiting time in the hospital, payments in the hospital, getting drugs, getting tested and all.
They look for a chemist or a pharmacy. That's basically one of the main touch points for everybody that falls sick in Nigeria.
They literally went from managing to being broke. We are a micro health insurance provider, and for us to stay on that micro level, it's important that we control all of these challenges. We see them every day.
The high cost of obtaining healthcare. A large percentage of the population do not have health insurance, and so they pay out of pocket, and that in itself poses a barrier to people accessing healthcare.
Health is wealth. It is true that the overall health of populations is a key determinant for economic growth. The fact is, we shouldn't underestimate the importance of good health in our lives. In developed countries around the world, we see the concerted efforts of governments to create health systems and to improve health systems, which actually lead to improved health outcomes in these developed countries. But how about developing countries such as countries in Africa? The situation is quite different. Addressing the healthcare situation in developing countries takes an unusual approach because healthcare is actually needed by those who can barely afford it. But there is hope in sight. With the help of the African Charities Dashboard created by the Deep Knowledge Group, I was able to discover a tech organization based in Abuja, Nigeria, which is leading efforts in ensuring that healthcare is delivered to those who really need it. And I'm on a mission to tell their story.
Hi, my name is Dr. Neto and I'm the founder and CEO of WellaHealth. I am an internal medicine physician, trained in Europe and worked in Australasia for a while before I returned to Nigeria to found WellaHealth. The motivation behind that was essentially me understanding that a lot of healthcare in Africa was really poor, having experienced it myself, and also via my family members who really couldn't get access to great healthcare.
Technology is a means to solve problems. In developing countries, technology is not only important, it can be critical. For instance, thanks to the availability of mobile technologies, small and medium businesses are able to thrive. And this technology remains the backbone of financial services all around Africa. But what if the same can be done for healthcare in Africa?
Being a physician abroad and helping them to navigate that, I realized that my calling lay in improving healthcare access for Africans. And so I moved back to Nigeria.
I live in a community myself at a place called Oribanwa, and that's in the Bejuleke area of Lagos State. I have a neighbor who it's just a regular man. And then his last son, I think about 3-year-old boy, fell sick. And then they had to spend about 25,000 naira to treat the guy. Now, it was a challenge. They literally went from managing to being broke.
As you know, community pharmacies are like the first point of call for a lot of people. You know, going to hospitals can be very, very demanding and has a lot of hassles, right? Before you get to the hospital, you see a lot of people there. You have to register with cards. You have to do a lot of things, see the consultant and all that. And that is a lot of activities, right? Before you now get your medical attention.
One of the reasons why people don't uptake insurance is because oftentimes it takes them out of the norm, the things that they know.
So typically, a Nigerian would spend hours trying to get treatment for something as simple as malaria, considering transportation, waiting time in the hospital, payments in the hospital, getting drugs, getting tested and all.
A large percentage of the population do not have health insurance, and so they pay out of pocket. And that in itself poses a barrier to people accessing healthcare.
The overall idea about healthcare, for instance, people believe that health insurance is for a select class of people. And the general Nigerian disposition to healthcare is, I don't know where that assumption comes of that you cannot be sick or you will not be sick. I mean, with everything mechanical, I'm not saying humans are mechanical, but to some extent we are, right? There's a breakdown period, right? So you have that to deal with.
One of the major problems of healthcare in Africa isn't just the provision of healthcare, but the access to healthcare in the first place. For many, the cost of visiting a hospital is as equal as the cost of getting the healthcare in the first place. And for many others, they simply have to make that choice between accessing healthcare or paying for healthcare and having to eat the next meal. For a large number of the Nigerian as well as the African population, they are just one single disease away from extreme poverty.
WellaHealth was understanding as well that technology really was the only way for healthcare to be better in Africa. Hence my journey into becoming an entrepreneur.
We are actually a group of people that are driven by one vision, which is to provide accessible and affordable healthcare for every African.
The idea of universal health coverage is part of the SDG goals 3.8, which is all about ensuring people have access to healthcare without adverse outcomes. So what that just means is that the fact that I'm treating a disease doesn't mean that I end up being poor, right? And if you look at the current state of the situation in the country, a lot of people that pay out of pocket are just like one illness away from poverty.
Reducing the cost of accessing basic care is the goal of WellaHealth. But how can people access quality healthcare in an affordable way? This poses a challenge, and the key word here is quality healthcare.
You hear family or stories of people that maybe the caregiver or the provider falls ill, and then the entire financial situation of that family goes down the drain. So, but the idea with universal health coverage is that people should be able to have access to healthcare without their whole lives stopping, their whole lives being adversely affected because of that. And WellaHealth is solving that problem by reducing the barrier of entry, the barrier to access to healthcare. One of the major limitations why people are not able to access healthcare as they should is because it's costly, it's expensive. The innovation around WellaHealth is creating a solution that is easy, makes it easy for you to access healthcare. Our plans cost you about $1 for a month.
Now, let's break it down a little bit and let's see what $1 can afford a person. $1 is about 500 naira, which is the cost of a plate of rice in Lagos or the cost of 5 mini bottles of Coca-Cola. Through WellaHealth's initiative, they have brought down the cost of preventing one of the deadliest diseases plaguing Africa, malaria, to 15 naira or 0.03 cents in a day. With this, the tomato seller on the street can actually access basic quality healthcare.
We also have plans that cover small businesses or small business owners. Just like I said earlier, our target is to actually reach all those people that make daily income. So whether she makes, let's say, 500 naira a day, you can break down your plan in such a way that with 15 naira a day, you can actually cover yourself for malaria, for common illnesses like cough, cold. We help to manage BP and blood sugar with, regular tests. So no matter how small you make in a day, WellaHealth can actually give you cover, like health cover.
Let's put this into context here. One of the most prevalent diseases in Africa is malaria. And as of 2020, global malaria deaths stood at about 627,000, with 4 African countries responsible for over 50% of the global death burden as a result of malaria. This is a problem.
One of the major limitations why people are not able to access healthcare as they should is because it's costly, it's expensive. You just think that before I go into the hospital to speak with the doctor, it's about 1,000 or 2,000. And we have over 70% of the population living below the poverty line, you understand? So how is that possible? That poverty line means less than $1 a day. So it's difficult for people to afford healthcare as it stands.
We just signed an agreement with the Association of Community Pharmacists of Nigeria, right? That's ACPN, and they have over 5,000 pharmacies under that network. And combined with the 1,500 pharmacies that we currently have, that means like we have at least 6,005 pharmacies across Nigeria that we can reach now. Because we understand how important pharmacies are to delivering care to people, individuals, quickly and affordably. That's why we decided to partner with pharmacists. And so far, it's been an amazing relationship because it's not just about us utilizing them for our own vision. We also render value-add services to them. One of those is that we give them loan. Like I said, I'm a credit manager. So we provide facilities for them where they can, if you want to stock up your pharmacy, you want to expand, or any other thing you would like to do with your business, we are there to support you financially.
But then this partnership between WellaHealth and these community pharmacies goes beyond just health provision and health servicing. It is symbiotic. This partnership between WellaHealth and the community pharmacies actually does more to deepen their relationships between each other. So I help you and you help me.
We also have some tools that they also use for their business. There's a particular one which is actually our pioneer product, which is Engage, right? And this is like a customer relationship management tool for the pharmacies where they input their patient's details, medical history, and all that. So it helps them develop a deeper relationship with their patient whenever they come into the pharmacies. So that and some other tools that we give to them has deepened the relationship that WellaHealth has with these pharmacies. And I can assure you that if you go to any of our partner pharmacies across Nigeria right now, they're going to have good testimonies to say about this relationship that we have with them. So it's been a wonderful partnership.
The innovation around WellaHealth is creating a solution that is easy, makes it easy for you to access healthcare.
At inception, one of the most important things for us, aside from trying to reduce the cost of accessing healthcare and making it affordable, was also improving the service. And accessibility became like a very important thing to us. And that was why, as a team, we got together to find how we can shorten the time people spend in accessing healthcare in the country.
Usually, your first port of call when you have a headache or body pain or a fever or a cough is you want to talk to, we know them as chemists. Because chemists are not properly regulated, we are upgrading them to pharmacists, so you can always go to a pharmacist. There's always that community pharmacist in every community that people look up to and they trust.
Regarding healthcare in Africa, there are 3 known levels of care. We have the primary healthcare system, which focuses on screenings, general checkups, basic illnesses, and wellness visits. There are also secondary and tertiary care, which provide a more specialized form of medical care. But then there is another level of care which is often overlooked: community pharmacies. Community pharmacies are usually the first point of call for the vulnerable population, which make up a large number of the people who live in Africa.
How can we cut off all those excesses and ensure that you get care immediately, conveniently as well, and also affordable? So we are looking at convenience, we're looking at affordability.
Convenience and affordability are 2 words that aren't usually used or frequently used together. For a country like Nigeria, which has over 40% of its citizens living below the poverty line and an estimated 5 million people said to have become poor due to COVID-19, having a micro health insurance plan becomes absolutely critical.
These guys are the first point of call, right? You can just walk 5 minutes, you always see a pharmacy around you, okay? So we decided to aggregate community pharmacies all over Nigeria, and then that way, anybody at any point in time in Nigeria can always walk into a pharmacy to get care. So after a customer purchases a microinsurance plan, right? In the event that probably, let's say, quarterly plan, for example, and then probably in the course of that period, they start feeling feverish or have symptoms of malaria or typhoid, right? All they have to do is call WellaHealth. We have a line dedicated for that. So once they place a call to us, our customer success officers would get their location. Where exactly are you right now? Okay, so once we know where you are at the moment, we'll locate the nearest pharmacy. Within 5 minutes to you, we can always get you a pharmacy where you can walk in for your healthcare. So once you call us, we'll get you a pharmacy that is close to you, and then we'd call the pharmacy to let them know that someone is coming for treatment. So on getting to the pharmacy will do the necessary tests, either malaria test or typhoid test, depending on the symptoms you present. And once they determine that you have either malaria or typhoid, then they give you antimalarial drugs or typhoid medication. And if it's something that's probably beyond what pharmacy can undo, then would refer you to our telemedicine service. So you have to get a doctor to call you, and they'll do a diagnosis and then refer you to hospital, as the case may be.
First is using technology, and of course building that on clinical principles. So we say, okay, what is the normal process for treating malaria, for example, or for managing any illness? You want to speak with the patient, you want to have some consultation, interaction. How are you feeling, and all of that. Next, you want to now get treatment and medication for that person, and then next you want to follow up to see, oh, did what I prescribed work? So just all of that clinical process. Do we have technology that can make that process easier? So those two, a merger of those two foundational points is how we are changing that narrative and making it more effective. So we have an amazing technology team that is innovating every day to ensure that we have seamless technological processes, and then we have people like myself who are on the other side ensuring that the processes we are creating align with clinical principles, and the patients get the best outcome.
And we have a particular product called PBM, Pharmacy Benefits Management, that allows health providers to have access to our network of pharmacies, and so we help them to be able to deliver quality drugs to their users.
Over the years, it has been quite difficult being an entrepreneur, especially in a nascent field like digital health, where there isn't a lot of existing success or support. And so I had to really create my own path in many ways, and build community as well, to be able to get much success.
Investing in the health system, especially in a country like Nigeria, isn't a bed of roses. Nigeria's budget on health hovered around 1.4 billion naira in 2021, while private spending for health in that same year was estimated at about 4.3 billion naira. And that equates to about 75% of health spending coming from private sources.
Regarding challenges that we currently face, I would say that a lot of it is related to capital, so getting access to the right capital to invest in growing. And then secondly, talent, so getting access to the right type of talents that have the right skills to help us grow to the level that we need to be or desire to be.
We work with a pharmacy model, right? Community pharmacy. So first of all, those ones, to onboard them is a hell of a task. When you look at the poverty situation, you look at the finance situation, everyone wants instant gratification. That includes some of these people, right? Of course, we have to use a credit system where somebody has to come their verification process to the claims and all that. So some of these businesses just say, no, we don't want to do that. We also leverage technology, which is another thing. These challenges are there from the businesses who don't want to use the tech-enabled process, who are used to how things are done, to the customer side, right?
So the big question is, should we invest in technology platforms that are actually committed to making healthcare affordable and accessible for Africans? In my opinion, I don't see why not.
On the funding side, it hasn't been easy. We are a venture-backed startup, and so we've had to raise money from lots of different types of venture capitalists all across the world, and it's taken a lot of time and effort to be able to get the money in to support the work that we do.
The major, or should I say our barrier, or the major challenge that we're actually facing is the fact that people don't know. And those that know are really dependent on a higher power, way higher than physical.
And then there's the religious factor, which is actually a problem. Many Africans tend to firmly believe that they will not fall ill for whatever reason. So they are quite hesitant to adopt health insurance.
Raising health awareness through health education with the use of our communities offline and online.
Although underfunded, I believe because we are working through the pharmacies, it makes it easier. So we spend money the more on our tech side, making sure we can attend, we can take your call wherever, we can connect to you instantly or whenever it is you request a claim, and then you can access your healthcare easily and as fast as possible.
There's a lot of work to be done. I think Africa is a greenfield essentially when it comes to impact. There's lots of amazing difference that can be made. We obviously working in healthcare are always looking at ways to make healthcare more affordable and increase access.
Technology can solve problems. And in the case of Africa's healthcare, it can do much more than that. it can save countless lives. Technology can also provide better investment opportunities right here in Africa.
Currently, we've served hundreds of thousands of patients. The magnitude of the impacts that we want to have is across millions of patients in multiple countries. So there's still lots of work to be done. Looking towards the future, our goal is to go deeper in Nigeria to serve millions of Nigerians with better healthcare, and also to expand across Africa. We're already exploring markets in East and West Africa and excited to be able to access them over the next few years.
So finally, technology can reduce the costs and the barrier of access to care, thereby improving the longevity and the lifespan of African lives. Thank you for watching.